Hey, Alphanurses, I'm Licensure from alphanurseguy.com. This is 30 practice NCLEX questions. Without the way, let's get started.
A client at 33 weeks gestation is admitted in preterm labor. She is given betamethasone 12 milligrams IM every 24 hours times 2. What is the expected outcome of this drug therapy? 1. The contractions will end within 24 hours. 2. The client will give birth to a neonate without infection. 3. The client will give birth to a full-term neonate. 4. The neonate will be born with mature lungs. The correct answer is 4. Betamethasone is a corticosteroid that induces the production of surfactant. The pulmonary maturation that results causes the fetal lungs to mature more rapidly than normal. Because the lungs are mature, the risk of respiratory distress in the neonate is lowered but not eliminated. Betamethasone also decreases the surface tension within the alveoli. Betamethasone has no influence on contractions or carrying the fetus to full term. It also does not prevent infection. A charge nurse and an LPN are working in the labor and birth unit. Of the following assessments and interventions that must be done immediately, which should the charge nurse assign to the LPN? 1. Complete an initial assessment on a client. 2. Increase the oxytocin rate on a laboring client. 3. Perform a straight catheterization for protein analysis. 4. Recover a mother following cesarean birth. The correct answer is 3. The straight catheterization is within the scope of practice of a licensed practical nurse. An initial or continuing assessment is the responsibility of the registered nurse. Assessment must be complete before increasing the IV rate of oxytocin. The assessment and the increase in oxytocin rate are responsibilities for the registered nurse. The RN, not the LPN, recovers clients who have had surgery because frequent assessments are needed. A client is experiencing agnosia as a result of vascular dementia. She is staring at dinner and utensils without trying to eat. Which intervention should the nurse attempt first? 1. Pick up the fork and feed the client slowly. 2. Say, "It's time for you to start eating your dinner." 3. Hand the fork to client and say, "Use this fork to eat your green beans." 4. Save the client's dinner until her family comes in to feed her. The correct answer is 3. Agnosia is the lack of recognition of objects and their purpose. The nurse should inform the client about the fork and what to do with it. Feeding the client does not address the agnosia or give the client specific directions. It should only be attempted if identifying the fork and explaining what to do with it is ineffective. Waiting for the family to care for the client is not appropriate unless identifying the fork and explaining or feeding the client is not successful. The family of a client diagnosed with Alzheimer's disease wants to keep the client at home. They say that they have the most difficulty in managing his wandering. The nurse should instruct the family to do which of the following? Select all that apply. 1. Ask the primary healthcare provider for a sleeping medication. 2. Install motion and sound detectors. 3. Have a relative sit with the client all night. 4. Have the client wear a medical alert bracelet. 5. Install door alarms and high door locks. The correct answers are 2, 4, and 5. Motion and sound detectors, a medical alert bracelet, and door alarms are all appropriate interventions for wandering. Sleep medications do not prevent wandering before and after the client is asleep and may have negative effects. Having a relative sit with the client is usually an unrealistic burden. A client reports having blurred vision after 4 days of taking haloperidol 1 milligram twice a day and benztropine 2 milligrams twice a day. The nurse contacts the primary healthcare provider to explain the situation, background, and assessment and make a recommendation. Which information reported to the primary healthcare provider is the assessment of the situation? 1. Mr. Roberts is taking 1 milligram of Haldol twice a day and Cogentin 2 milligrams twice a day. 2. I think Mr. Roberts might need a lower dose of Cogentin. 3. Mr. Roberts reports having blurred vision since this morning. 4. The higher dose of Cogentin could be causing Mr. Roberts' blurred vision. The correct answer is 4. Cogentin has a common side effect of blurred vision. After evaluating the relative doses of Haldol and Cogentin, the assessment would be that the higher dose of Cogentin compared to the dose of Haldol is responsible for the blurred vision. High doses of Haldol can cause blurred vision at times. Reporting that Mr. Roberts has blurred vision is the situation. Listing the medications and doses is describing the background. The recommendation would be a lower dose of Cogentin. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is preparing a community presentation on oral cancer. Which of the following is a primary risk factor for oral cancer that the nurse should include in the presentation? 1. Use of alcohol. 2. Frequent use of mouthwash. 3. Lack of vitamin B12. 4. Lack of regular teeth cleaning by a dentist. The correct answer is 1. Chronic and excessive use of alcohol can lead to oral cancer. Smoking and use of smokeless tobacco are other significant risk factors. Additional risk factors include chronic irritation such as a broken tooth or ill-fitting dentures, poor dental hygiene, overexposure to sun and syphilis, use of mouthwash, lack of vitamin B12, and lack of regular teeth cleaning appointments have not been implicated as primary risk factors for oral cancer. The nurse is caring for a client who has had a gastroscopy. Which of the following may indicate that the client is developing a complication related to procedure? Select all that apply. 1. The client has a sore throat. 2. The client has a temperature of 100 degrees Fahrenheit. 3. The client appears drowsy following procedure. 4. The client has epigastric pain. 5. The client experiences hematemesis. The correct answers are 2, 4, and 5. Following a gastroscopy, the nurse should monitor the client for complications, which include perforation and the potential for aspiration. An elevated temperature, epigastric pain, or the vomiting of blood are all indications of a possible perforation and should be reported promptly. A sore throat is a common occurrence following a gastroscopy. Clients are usually sedated to decrease anxiety, and the nurse would anticipate that the client will be drowsy following the procedure. A client is taking an antacid for treatment of a peptic ulcer. Which of the following statements best indicates that the client understands how to correctly take the antacid? 1. I should take my antacid before I take my other medications. 2. I need to decrease my intake of fluids so that I don't dilute the effects of my antacid. 3. My antacid will be most effective if I take it whenever I experience stomach pains. 4. It is best for me to take my antacid 1 to 3 hours after meals. The correct answer is 4. Antacids are most effective if taken 1 to 3 hours after meals and at bedtime, when an antacid is taken on an empty stomach. The duration of the drug's action is greatly decreased. Taking antacids 1 to 3 hours after a meal lengthens the duration of action, thus increasing the therapeutic action of the drug. Antacids should be administered about 2 hours after other medications to decrease the chance of drug interactions. It is not necessary to decrease fluid intake when taking antacids. If antacids are taken more frequently than recommended, the likelihood of developing adverse effects increases. Therefore, the client should not take antacids as often as desired control pain. After a subdural gastrectomy, the nurse is developing a plan with the client to assist the client to gain weight. To help the client meet nutritional goals at home, the nurse should 1. Instruct the client to increase the amount eaten at each meal. 2. Encourage the client to eat smaller amounts more frequently. 3. Explain that if vomiting occurs after meal, nothing more should be eaten that day. 4. Inform the client that bland foods are typically less nutritional and should be used minimally. The correct answer is 2. Because of the client's reduced stomach capacity, frequent small feedings are recommended. Early satiety can result, and large quantities of food are not well tolerated. Each client should progress at his or her own pace, gradually increasing the amount of food eaten. The goal is 3 meals daily if possible, but this can take 6 months or longer to achieve. Nausea can be episodic and can result from eating too fast or eating too much at one time. Eating less and eating more slowly, rather than not eating at all, can be a solution. Bland foods are recommended as starting foods because they are easily digested and are less irritating to the healing mucosa. Bland foods are not less nutritional. An infant is to be discharged after surgery for intussusception. In developing the discharge teaching plan, the nurse should tell the mother, 1. The infant will experience a change in the normal home routine. 2. The infant can return to the pre-hospital routine immediately. 3. The infant needs to ingest more calories at home than what was consumed in the hospital. 4. The infant will continue to experience abdominal cramping for a few days. The correct answer is 1. Infants who have had an interruption in their normal routine and experiences, such as hospitalization and surgery, typically manifest behavior changes when discharged. The infant's normal routine has been significantly altered, so it will take time to reestablish another routine. Calorie requirements at home will continue to be the same as those in the hospital. The infant does not need more calories at home. The surgical procedure corrected the problems, so the infant should not continue to have abdominal cramping. When developing the preoperative plan of care for an infant with Hirschsprung's disease, which of the following should the nurse include? 1. Administering a tap water enema. 2. Inserting a gastrostomy tube. 3. Restricting oral intake to clear liquids. 4. Using povidone iodine solution to prepare the perineum. The correct answer is 3. Before intestinal surgery, dietary intake is limited to clear liquids for 24 to 48 hours. A clear liquid diet meets the child's fluid needs and avoids the formation of fecal material in the intestine. Typically, repeated saline enemas, not tap water enemas, are given to empty the bowel. Soap suds enemas are contraindicated for infants, as are tap water enemas. A nasogastric tube may be inserted for gastric decompression. Insertion of a gastrostomy tube is outside the scope of nursing practice. Because the perineal area is not involved in the surgery, it does not need to be prepared. Which of the following would be an important assessment finding for an 8-month-old infant admitted with severe diarrhea? 1. Bowel sounds every 5 seconds. 2. Pale yellow urine. 3. Normal skin elasticity. 4. Depressed anterior fontanelle. The correct answer is 4. An infant with severe diarrhea will experience some degree of dehydration. In an 8-month-old child, the anterior fontanelle has not closed. Therefore, a depressed anterior fontanelle would be an important finding. Additionally, the infant would exhibit dry mucous membranes, lethargy, hyperactive bowel sounds, dark urine, and sunken eyeballs. Skin turgor will be decreased or delayed. Bowel sounds every 5 seconds would not be considered abnormal for an infant. Which of the following would alert the nurse to suspect that a child with severe gastroenteritis who has been receiving intravenous therapy for the past several hours may be developing circulatory overload? 1. A drop in blood pressure. 2. Change to slow, deep respirations. 3. Auscultation of moist crackles. 4. Marked increase in urine output. The correct answer is 3. An early sign of circulatory overload is moist rales or crackles heard when auscultating over the chest wall. Elevated blood pressure, engorged neck veins, a wide variation between fluid intake and output, with a higher intake and output, shortness of breath, increased respiratory rate, dyspnea, and cyanosis occur later. A multigravida client is admitted at 4 centimeters dilation and requesting pain medication. The nurse gives the client nalbuphine 15 milligrams. Within 5 minutes, the client tells the nurse she feels like she needs to have a bowel movement. The nurse should first, 1. Have naloxone hydrochloride available in the birthing room. 2. Complete a vaginal examination to determine dilation, effacement, and station. 3. Prepare for birth. 4. Document the client's relief due to pain medication. The correct answer is 2. The feeling of needing to have a bowel movement is commonly caused by pressure on the receptors low in the perineum when the fetal head is creating pressure on them. This feeling usually indicates advances in fetal station and that the client may be close to birth. The nurse should respond initially to the client's signs and symptoms by checking to validate current effacement, dilation, and station. If the fetus is ready to be born, having the room ready for the birth and having naloxone hydrochloride available are important. Narcan completely or partially reverses the effects of natural and synthetic opioids, including respiratory depression. Documenting pain relief takes time away from a vaginal examination, preparing for birth, and obtaining Narcan. The birth may be occurring rapidly. Being prepared for the birth is a higher priority than documentation for this client. When assessing the frequency of contractions of a multiparous client in active labor admitted to the birthing area, the nurse should assess the interval between which of the following: 1. Acme of one contraction to the beginning of the next contraction. 2. Beginning of one contraction to the end of the next contraction. 3. End of one contraction to the end of the next contraction. 4. Beginning of one contraction to the beginning of the next contraction. The correct answer is 4. To assess the frequency of the client's contractions, the nurse should assess the interval from beginning of one contraction to the beginning of the next contraction. The duration of contraction is the interval between the beginning and the end of a contraction. The acme identifies the peak of a contraction. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A full-term client is admitted for an induction of labor. The healthcare provider has assigned a Bishop score of 10. Which drug would the nurse anticipate administering to this client? 1. Oxytocin 30 units in 500 milliliters D5W. 2. Prostaglandin gel 0.5 milligrams. 3. Misoprostol 50 micrograms PO. 4. Dinoprostone 10 milligrams. The correct answer is 1. A Bishop score evaluates cervical readiness for labor based on 5 factors: cervical softness, cervical effacement, dilation, fetal position, and station. A Bishop score of 5 or greater in a multipara, or a score of 8 or greater in a primipara indicate that a vaginal birth is likely to result from the induction process. The nurse should expect that labor will be induced using oxytocin because the Bishop score indicates that the client is 60% to 70% effaced, 3 to 4 centimeters dilated, and in an anterior position. The cervix is soft and the presenting part is at a -1 to 0 position. Prostaglandin gel, misoprostol, and dinoprostone are all cervical ripening agents, and the doses are accurate. However, cervical ripening has already taken place. A nurse and a nursing assistant are caring for clients in a labor and birth unit. Which task should the nurse assign to the nursing assistant? 1. Perform a fundal check on a 2-day postpartum client. 2. Remove a fetal monitor and assist a client to the bathroom. 3. Give ibuprofen 800 milligrams by mouth to a newly postpartum client. 4. Teach a new mother how to bottle feed her infant. The correct answer is 2. Removing a fetal monitor from a client and assisting her to the bathroom are within the realm of practice of a nursing assistant. Performing a fundal check is an assessment, which is a responsibility of a nurse. A nursing assistant is not permitted to administer medication by any route. Education is also part of the professional nursing role. Although a nursing assistant can assist a mother with bottle feeding, the formal client education must be completed and validated by the nurse. A client with early dementia exhibits disturbances in her mental awareness and orientation to reality. The nurse should expect to assess a loss of ability in which of the following other areas? 1. Speech. 2. Judgment. 3. Endurance. 4. Balance. The correct answer is 2. Clients with chronic cognitive disorders experience defects in memory orientation and intellectual functions, such as judgment and discrimination. Loss of other abilities, such as speech, endurance, and balance, is less typical. Which of the following is a priority to include in the plan of care for a client with Alzheimer's disease who is experiencing difficulty processing and completing complex tasks? 1. Repeating the directions until the client follows them. 2. Asking the client to do one step of the task at a time. 3. Demonstrating for client how to do the task. 4. Maintaining routine and structure for the client. The correct answer is 2. Because the client is experiencing difficulty processing and completing complex tasks, the priority is to provide the client with only one step at a time, thereby breaking the task up into simple steps, ones that the client can process. Repeating the directions until the client follows them or demonstrating how to do the task is still too overwhelming to the client because of the multiple steps involved. Although maintaining structure and routine is important, it is unrelated to task completion. When developing a teaching plan for the community about managed care models and their effect on clients with chronic mental illnesses, which of the following factors should the nurse include as detrimental to this population? Select all that apply. 1. Restriction in the range and quantity of services. 2. Hospitalization reserved for emergency services. 3. Non-shifting of funding to outpatient services when clients are moved to these services. 4. Loss of the principle of least restrictive alternative for care. 5. Lack of sufficient numbers of group homes and supervised apartments. The correct answers are 1 and 3. Without a sufficient range and quantity of services, care is inadequate and hospitalization rates increase. Non-shifting of allocated funding to outpatient services has increased the problem with the range and quantity of services. Reserving hospitalization for emergency services was a practice before managed care. The principle of least restrictive alternative is still as relevant as it was before managed care. There are not enough group homes available. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguy.com. Back to the questions. A client has entered a smoking cessation program to quit a 2-pack-a-day cigarette habit. The client has not smoked a cigarette for 3 weeks and tells the nurse about fears of starting smoking again because of current job pressures. What would be the most appropriate reply for the nurse to make in response to the client's comments? 1. Don't worry about it. Everybody has difficulty quitting smoking, and you should expect to as well. 2. If you increase your self-control, I am sure you'll be able to avoid smoking. 3. Try taking a couple of days of vacation to relieve the stress of your job. 4. It is good that you can talk about your concerns. Try calling a friend when you want to smoke. The correct answer is 4. It is important for individuals who are engaged in smoking cessation efforts to feel comfortable with sharing their fears of failure with others and seeking support. Although fewer than 5% of smokers successfully quit on their first attempt, it is not helpful to tell a client to anticipate failure. Telling the client to exercise more self-control does not provide support. Taking a vacation to avoid job pressures does not address the issue of how to manage the desire to smoke when in a stressful situation. A client admitted to the hospital with peptic ulcer disease tells the nurse about having black, tarry stools. The nurse should 1. Encourage the client to increase fluid intake. 2. Advise the client to avoid iron-rich foods. 3. Place the client on contact precautions. 4. Report the finding to the healthcare provider. The correct answer is 4. Black, tarry stools are an important warning sign of bleeding in peptic ulcer disease. Digestate blood in the stool causes it to be black. The odor of the stool is very offensive. The nurse should instruct the client to report the incidence of black stools promptly to the primary healthcare provider. Increasing fluids or avoiding iron-rich foods will not change the stool color or consistency if the stools contain digestate blood. Until other information is available, it is not necessary to initiate contact precautions. Which of the following would be an expected outcome for a client with peptic ulcer disease? The client will 1. Demonstrate appropriate use of analgesics to control pain. 2. Explain the rationale for eliminating alcohol from the diet. 3. Verbalize the importance of monitoring hemoglobin and hematocrit every 3 months. 4. Eliminate engaging in contact sports. The correct answer is 2. Alcohol is a gastric irritant that should be eliminated from the intake of the client with peptic ulcer disease. Analgesics are not used to control ulcer pain. Many analgesics are gastric irritants. The client's hemoglobin and hematocrit typically do not need to be monitored every 3 months unless gastrointestinal bleeding is suspected. The client can maintain an active lifestyle and does not need to eliminate contact sports as long as they are not stress-inducing. To reduce the risk of dumping syndrome, the nurse should teach the client to do which of the following? 1. Sit upright for 30 minutes after meals. 2. Drink liquid with meals, avoiding caffeine. 3. Avoid milk and other dairy products. 4. Decrease the carbohydrate content of meals. The correct answer is 4. Carbohydrates are restricted, but protein, including meat and dairy products, is recommended because it is digested more slowly. Lying down for 30 minutes after meal is encouraged to slow movement of the food bolus. Fluids are restricted to reduce the bulk of food. There is no need to avoid caffeine. When assessing an infant with suspected inguinal hernia, which of the following findings will be most significant? 1. The inguinal swelling is reddened and the abdomen is distended. 2. The infant is irritable and a thickened spermatic cord is palpable. 3. The inguinal swelling can be reduced and the infant has a stool in a diaper. 4. The infant's diaper is wet with urine and the abdomen is non-tender. The correct answer is 1. Abdominal distension and a redness of the inguinal swelling are significant findings. Their presence in conjunction with area tenderness and inability to reduce the hernia indicate an incarcerated hernia. An incarcerated hernia can lead to strangulation, necrosis, and gangrene of the bowel. Other findings associated with strangulation include irritability, anorexia, and difficulty in defecation. Irritability is nonspecific and could be caused by various factors. A palpable, thickened spermatic cord on the affected side is diagnostic of inguinal hernia and would be an expected finding. A wet diaper indicates that urine is being excreted, a finding unrelated to inguinal hernia. Before we move on to the next question, the NCLEX Mastery Bundle is available. It includes over 100 animated review videos, hundreds of pages of notes, hundreds of case study questions, and over 1,000 NCLEX questions. Link is in the description, or you can get it at alphanurseguide.com. Back to the questions. The nurse is showing the parent of a child with Hirschsprung's disease where the ganglionic area is located. Identify the area the nurse should point out as being a ganglionic. 1A, 2B, 3C, 4D. The correct answer is 4. In most instances, the absence of ganglionic innervation occurs in the lower portion of the sigmoid colon, just above the anus. Which of the following will be the best activity for the nurse to include in the plan of care for an infant experiencing severe diarrhea? 1. Monitoring the total 8-hour formula intake. 2. Weighing the infant each day. 3. Checking the anterior fontanelle every shift. 4. Monitoring abdominal skin turgor every shift. The correct answer is 2. Because an infant experiencing severe diarrhea is at high risk for a fluid volume deficiency, the nurse needs to evaluate the infant's fluid balance status by weighing the infant at least every day. Body weight is the best indicator of hydration status because a higher proportion of an infant's body weight is water compared with an adult. Initially, the infant with severe diarrhea is not allowed liquids, but is given fluids intravenously. Therefore, monitoring the oral intake of formula is inappropriate. Although checking the anterior fontanelle for depression or bulging provides information about hydration status, this method is not considered the best indicator of the infant's fluid balance. Monitoring skin turgor can provide information about fluid volume status. The abdomen is commonly used to assess skin turgor in an infant because it is a large surface area and can be accessed quickly. However, weight is the best indicator of fluid balance. The stool culture of a child with profuse diarrhea reveals Salmonella bacilli. After teaching the mother about the course of Salmonella enteritidis, which of the following statements by the mother indicates effective teaching? 1. Some people become carriers and stay infectious for a long time. 2. After the acute stage passes, the organism is usually not present in the stool. 3. Although the organism may be alive indefinitely, in time it will be of no danger to anyone. 4. If my child continues to have the organism in the stool, an antitoxin can help destroy the organism. The correct answer is 1. After having S. Enteritidis. Some clients become chronic carriers of the causative organism and remain infectious for a long time as the organism continues to be shed from the body. During this time, the child is still considered infectious. No antitoxin is available to treat or prevent salmonella infections. A multigravida laboring client has an extensive documented history of drug addiction. Her last reported usage was 5 hours ago. She is 2 centimeters dilated with contractions every 3 minutes of moderate intensity. The primary healthcare provider prescribes nalbuphine 15 milligrams slow IV push for pain relief followed by an epidural when the client is 4 centimeters dilated. Within 10 minutes of receiving the nalbuphine, the client states she thinks she is going to have her baby now. Of the following drugs available at the time of the birth, which should the nurse avoid using with this client in this situation? 1. 1% lidocaine. 2. Naloxone hydrochloride. 3. Local anesthetic. 4. Pudendal block. The correct answer is 2. Naloxone hydrochloride would not be used in a client who has a history of drug addiction. Narcan would abruptly withdraw this woman from the drug she is addicted to as well as the nalbuphine. The withdrawal would occur within a few minutes of injection and, if severe enough, could jeopardize the mother and fetus. Xylocaine is a local anesthetic and numbs rather than decreases the effects of Narcan. The local anesthetic and the pudendal block are both appropriate for this birth, but are used to numb the maternal perineum for birth. While a client is being admitted to the birthing unit, she states, "My water broke last night, but my labor started 2 hours ago." Which of the following is concern? Select all that apply. 1. Maternal vital signs. Temperature, 99.5, heart rate, 80, respiration. 24, blood pressure 130/80. 2, blood and mucus on perineal pad. 3, baseline fetal heart rate of 140 with a range between 110 and 160 with contractions. 4, peripad stained with green fluid. 5, the client states, "This baby wants out. He keeps kicking me." The correct answers are 3, 4, and 5. The range of fetal heart rate fluctuating too high and low could indicate fetal distress. The green peripad fluid indicates meconium, which could be associated with fetal distress. Increased fetal activity during labor may also indicate distress. The maternal vital signs noted and a perineal pad with blood and mucus are normal findings. You can get the NCLEX Mastery Bundle now. Link is in the description, or you can get it at alphanurseguy.com.